Welcome back to my channel. Learn with Professor Janula. If you're new here, don't forget to subscribe and hit the bell icon for notifications. In today's video, we're going to learn about the management during first stage of labor. Let's get started. The first stage of labor is the period that starts when a woman begins to feel true labor pains and continues until the cervix is fully opened to 10 centimeters. During this stage, the cervix slowly opens and thins out to allow the baby to pass through. This stage is divided into 3 phases: latent, active, and transition, based on how fast the cervix dilates and how strong the contractions are. The main focus of care during this time is to keep the mother comfortable, closely monitor the baby's well-being, and make sure that labor is progressing normally. The main objectives during this stage of labor are quite simple and practical. First, we want to make sure that labor is progressing safely and normally, without unnecessary delays. At the same time, we continuously monitor both the mother and the baby to ensure they are stable and doing well throughout the process. Another important goal is to identify any problems early so that complications can be prevented or managed on time. Along with all this, providing emotional reassurance and physical comfort to the mother is very important, because calm support can make a big difference in how well she copes with labor. When we talk about assessment and monitoring in the first stage of labor, we mainly focus on the mother. We regularly check her vital signs, like blood pressure, pulse, and temperature, usually every 4 hours or more often if needed, to make sure she is stable. At the same time, we assess her pain level and how well she is coping with contractions, because every woman handles labor differently. We also pay attention to bladder status and encourage her to pass urine every 2 hours, as a full bladder can interfere with labor progress. Along with this, ensuring proper hydration and light nutrition is important to maintain her energy levels and prevent exhaustion during labor. Vaginal examination is done only when necessary and always according to hospital protocol, keeping the mother's comfort and privacy in mind. Through this examination, we assess how much the cervix has opened and thinned out, which tells us how labor is progressing. We also check the station and position of the presenting part to understand how the baby is moving down the birth canal. In addition, we note the status of the membranes, whether they are intact or ruptured, as this information helps us plan further management and monitor labor safely. Now coming to fetal assessment, our main focus is on monitoring the baby's heart rate to make sure the fetus is tolerating labor well. In low-risk mothers, we usually check the fetal heart rate every 30 minutes, whereas in high-risk cases, it is monitored more frequently, about every 15 minutes. While listening to the fetal heart sounds, we also watch for any decelerations or abnormal patterns, because these can be early signs of fetal distress and help us take timely action. To understand how labor is progressing, we use a tool called the Partograph, which helps us record and track important findings in a simple visual way. On the Partograph, we regularly note the cervical dilatation to see whether it is increasing at an expected rate. We also monitor the pattern and strength of uterine contractions, as effective contractions are needed for progress. Along with this, the fetal heart rate is charted to ensure the baby is coping well with labor, and the mother's overall condition is observed so that any deviation from normal can be identified early. During the latent phase of the first stage of labor, when cervical dilatation is up to about 3 to 4 centimeters, the main aim is to keep the mother calm, comfortable, and confident. At this stage, we reassure her that labor has started and explain what she can expect, which helps reduce fear and anxiety. We encourage her to walk around and adopt comfortable positions, as this can help labor progress naturally. If permitted, she can be given light oral fluids to maintain hydration and energy. Teaching simple breathing and relaxation techniques helps her cope better with the mild contractions, and we avoid unnecessary vaginal examinations to reduce discomfort and the risk of infection. In the active phase of labor, when the cervix is dilated from about 4 to 7 centimeters, contractions become stronger, longer, and more regular, so the mother needs continuous support. At this stage, we stay with her, encourage upright and comfortable positions, and help her move as tolerated, since this can aid descent of the baby. We closely assess the contractions by observing their frequency, duration, and intensity to judge how effective they are. Pain relief becomes more important here, so we use non-pharmacological methods like breathing techniques, massage, and warm compresses, and give analgesics if prescribed. Throughout this phase, we carefully monitor the fetal heart rate and overall progress of labor to ensure both the mother and baby are coping well. During the transition phase, when the cervix is almost fully dilated, from 8 to 10 centimeters, labor becomes very intense, and this is often the most challenging phase for the mother. At this time, constant emotional support is extremely important, as she may feel anxious, tired, or overwhelmed. We stay close and guide her with proper breathing techniques to help her cope with strong contractions and avoid pushing too early. We carefully watch for the urge to bear down, which indicates that full dilatation is near. At the same time, we start preparing for the second stage of labor and make sure the bladder is empty, as this helps with effective pushing and smooth progress. Along with phase-wise care, there are some general nursing interventions that should be followed throughout the first stage of labor. We must always maintain strict aseptic technique to prevent infection and ensure the safety of both mother and baby. At the same time, it is very important to respect the woman's privacy and dignity by providing proper draping and a supportive environment, if hospital policy allows. Encouraging the presence of a birth companion can give the mother emotional comfort and confidence. Throughout labor, continuous reassurance from the nurse helps reduce anxiety, builds trust, and supports the mother in coping effectively with the labor process. Throughout the first stage of labor, it is very important to stay alert for any signs of complications. We closely observe the progress of labor to identify prolonged labor where cervical dilatation or descent is slower than expected. Continuous monitoring of the fetal heart rate helps us detect early signs of fetal distress. We also watch the color of the amniotic fluid, as meconium-stained liquor can indicate fetal compromise. In addition, a mother's physical and emotional condition is assessed regularly so that signs of exhaustion can be identified early and managed promptly. Documentation is a very important part of nursing care during labor. Whatever we assess or do should be clearly and accurately recorded. This includes charting the mother's vital signs, fetal heart rate, and findings from vaginal examinations, as these reflect the progress of labor. We also document all nursing and medical interventions along with how the mother responds to them. At the same time, the Partograph should be kept up to date, as it gives a clear picture of labor progress and helps in early identification of any problems. To conclude, proper management of the first stage of labor plays a key role in ensuring that labor progresses normally and safely. By providing continuous monitoring, timely interventions, and supportive nursing care, we can help keep the mother comfortable and relaxed, while also ensuring the safety and well-being of the baby. Good nursing care during this stage sets the foundation for a smooth second stage of labor and a positive childbirth experience for the mother. Thank you for watching. I hope this session helped you understand the nursing management of the first stage of labor in a clear and practical way. If you found the explanation useful, please feel free to like, comment, share, and subscribe for more learning content.